Yes, it's very high. And in fact, if you think about it, a person's lifetime risk of acquiring a genital HPV infection is 70 to 80%. So in many ways, it's more normal to have or have had HPV than it is not to. India has a unique challenge in that it's a very large, very rapidly growing country, and with a lot of disparity ranging from the wealthy in cities to small villages. And so really there's two ways to reduce HPV-associated malignancies. One is cervical screening, right? Pap screening. And this is certainly effective, and obstetrician gynecologists have done amazing things in terms of reducing the severity of disease. But remember, this is secondary. This is already recognizing, treating disease that's there. So primary prevention by vaccination is really the most effective way. And then the wonderful thing about primary prevention is it doesn't matter where you live. So the age groups for HPV vaccination in India are relatively, it's rather complicated right now because there's two vaccines. So there is the quadrivalent vaccine, and that's available for females aged 9 to 45. And certainly all of them should be vaccinated. And then there's the 9-valent vaccine, and that's the gender-neutral vaccine, and that's available for males 9 to 15, and for females 9 to 26. Now, you asked the question, who should be vaccinated? And there's a lot of ways to answer that question. You could simply say, who deserves cancer prevention? And of course, then you say everybody. I often joke with our pediatric residents. I say, only vaccinate the children you love. So inequity is a big problem, and there are lots of people who should be receiving HPV vaccine that, for a variety of reasons, cannot. Certainly economics is a big concern, and this is like every other aspect of healthcare. I think another cause of inequity, of course, is education. People don't understand that this is important, and there's things that we can do that are cost beneficial that will reduce the misery of cancer related to HPV. What can we do? Well, there's lots of organizations, Gavi, the World Health Organization, each of them very involved in promoting global vaccination. And I think what we need to do is get behind those organizations. That's, of course, a problem for health economists. I wish I had a good answer for that. But I think the answer is that we have to take a good, hard scientific look. And of course, anytime a vaccine is being brought into any country, the health economists need to look. And I think people need to do careful health economic studies to say, well, is this the right thing to do for India? Now, based on the experiences in the rest of the world, the answer will be yes. But I think the Indian people deserve that answer from their own health economists. That's a very important question, and it's an evolving target. So the letter and verse from Indian regulatory bodies is that it's a 3-dose series, 0, 2, and 6 months. Now, an important point there. A dose delayed still counts. So if you give somebody their first dose and then you give somebody their second dose and they don't show up for a year, the third dose still counts. So every dose you give counts. The second issue is, what about the smaller schedules, the 2-dose schedules? And these are being certainly used in many places in the world, especially for boys and girls under the age of 15. There's good evidence that these schedules work just fine. That's still an issue for regulatory bodies in India, and I know that some of the professional advisory groups are advocating for a 2-dose schedule. There is a 1-dose schedule that's being researched. And of course, we think that this would be especially exciting for limited resource situations. How this is going to work out long term remains to be seen, but this is something very exciting, so watch this space. But in the meantime, in India, 3 doses. In the United States, and it's important to emphasize, I'm not here to tell people what to do. Indian physicians are very, very smart. I'm here to share my experience as a North American pediatrician. And I've been watching this since 2006. And we made several mistakes along the way. The first mistake we made is we didn't talk about vaccination the right way. We had the mistaken idea, not just we as a medical profession, but the CDC and the pharmaceutical industry, that if we just gave people enough facts, they would make the right decision. And yet, any educational psychologist, any teacher knows that people make decisions as much about what they feel as what they know. So research is now beginning to show that our message needs to be changed from an information dump to people to actually providing them with something succinct and to the point. So the first thing is we had to hone our message properly. The other thing is I think we should prepare ourselves better for the inevitable anti-vaccine onslaught. We saw that in the United States, but we've seen it even more severely in other countries. Ireland had a horrible event where anti-vaccine people really crashed their national program. So if I were to give advice to professional groups in India, it would be to sit down and try and think of everything that could possibly be brought up and prepare yourselves for every kind of criticism so that you're ready to act and stay a move ahead of the anti-vaccine people. So I think there's a couple of things we need to spread. I think one of the worries we have is that people get mired down in looking at the wrong issue. Very early in the game, somebody's going to use the word sexually transmitted when it comes to HPV. And all of a sudden you can hear lots of parents and people putting on the brakes. And all of a sudden we begin to tie immunization to morality. That's a dangerous conversation. And it's a conversation that leads you down the wrong way because it ends up that people don't get vaccinated and people don't get protected. So I think one of the things we have to do is teach people to keep the conversation focused on cancer prevention. Because really, that's what we're doing here. We are trying to take what is the #2 cancer killer of women in India and eliminate it. To take something that causes almost immeasurable human suffering and take it out of people's conscience. So my advice is, whenever possible, keep the focus on cancer prevention and normalize that idea that this is just what we do for our young people because we love them. So the world of vaccine hesitancy is very diverse. And there are as many reasons to be opposed to vaccination as there are people. But I think the way we address it is a couple of points. First of all, parents, patients will come to you and they will gain confidence in you by what you know. They want to know that as a provider, you're an expert. But what actually gets people vaccinated is not your expertise, but your passion. That you're managing to convince people that this is the right thing for them to do for their children or for themselves. Speaking for myself, I'm proud to tell you that my daughters were probably the first 2 young women in Chicago to be vaccinated after the vaccine became available. Why? Because second only to my wife, these are the 2 most precious things in the world to me. So how can we address the concerns of people? Well, we understand that parents, patients really only want to know 3 things. And this is the same for every vaccine. They want to know, does it work? Is it safe? And what's my provider's recommendation? Does it work? There's now a world of experience. The Australians are on the cusp of eliminating HPV disease from their societies. They're talking about it in Canada, the United States, and in Europe. So does it work? It works really, really well. Is it safe? We now have 17 years worth of safety data. And what we know in the end is that it gives you a sore arm. Beyond that, no new safety signals have emerged. And then the most important thing, which is, what is the provider's recommendation? What are you saying as a provider? And parents and patients are not looking for, it's available, give it if you want to do it. What they're looking for is for you to say, this is Ajit's 11th birthday. At 11, we vaccinate our young men against cancer, and we should do it today.